Oh, I know you've helped so many people with microcurrent, and that's really what we're trying to do here, right, at Pain Free for Life and with our allies, clinics around the world, is to help people get out of pain. But it goes beyond pain. It's also disease. It's the state of the body being in dysfunction and what we can do to help that. I think it often gets kind of caught up in the pain cycle, and people are like, I don't have pain, but they've got inflammation, right? They've
Yes.
got other things.
Yeah.
So, could you talk a little bit about how you got involved with microcurrent in the first place? What was your first experience with it? Like, what were you doing before you got into microcurrent?
Well, so former military, worked everywhere from the OR to assisting in autopsies. That's actually where I got my love of the sciences. Otherwise, I was the squeamish one when I saw a needle on TV and I'd go, ooh. Um, but yeah, I just got very interested. And so a number of things led me outside of traditional, conventional medicine, my own health, looking for things that could help me. I mean, I went through everything from essential oils, nutrition. I met your dad, and took all of his courses that I could, attend, and because I started to actually see a change, one of the first things or areas that I saw a change was in the health of my liver. I actually, got involved and understood that this technology could actually help my liver. I'm had liver issues because of serving with the Marines at Camp Lejeune. And I'll tell you, I'm almost 10 years later, and my liver looked like a brisket. It was heavily striated with scars. And I believe it was from all the chemicals. Of course, they won't, state what that's about. But today is slightly striated. So
Yeah.
yay me. So that's actually how I got involved, and then brought it into the practice that I had, which was nutrition and functional medicine. And, here we are today, thousands of clients later, and lots of beta testing with you and pain free for life, and, just excited. And I really am an advocate. I want people to know that this is available. So if I seem a little excited, it's because I know that we are going to help somebody out there some way. And I cannot express how that um, fills my heart.
And I think that's what it's all about. Like in the end, we often look at this and we say, if we can just touch one person, even one person out of the people that are watching today, for example, and get them the relief they need, it's like it's a blessing because it passes from one to another. Like you never help just one because that one person gets the help they need, then they tell someone else that needs help, and it becomes a movement more than it does just. It's not just about a product; it's about better health for everyone, right? That is the name of the game.
Yeah, and I would agree. This isn't, for me, it's not about a product. You have, and have created and have improved on a technology, that Tim Smith started and his team, and you have just continued to create it better. I mean, I have used other microcurrents. I do use other frequency devices in my clinic, but this is 99% of what I do outside of always adding nutrition for the rebuild of that missing tissue, because microcurrent cannot replace missing tissue. But yeah, I really do feel that, I mean, I haven't personally seen another technology that works consistently this swiftly in not just pain, but in a minute we'll talk about the lung trials
Yes.
and the success there. But I've seen it in, I mean, fibromyalgia. We're doing vagus nerve stimulation. And, I have a lady, I just happened to be videoing, and she takes her glasses off. And she says, Yvonne, I can see clear across the room. 82 years old. we're impacting the sphenoid bone. We're impacting all of those bone structures that could, in fact, just be slightly impinging upon one of those cranial nerves. And as you know, there's lots of, research just about the ability for what the sphenoid misalignment, if what that can do. I mean, we could have a video just on that and change the world.
Yeah, yeah. Yeah, no, absolutely. And there's so a couple people are really like hitting on the liver piece, and I would agree with you there. Like, this was something that my dad, John, always used to talk about with the old Russian technology was that they would just kind of, heal livers, like get rid of that. Because so much of the liver damage, even fatty liver, right, is it's actually scarring on the liver. And if you can remove that scarring, you can actually start to heal. The liver is probably one of the most remarkable organs in its ability to repair. But of course, it's not really going to have that if it's covered in scars. So that's a big piece of this. And someone is asking, what technology do you use to replace tissue? And I think you were saying it's nutrition. You need the nutrients so the microcurrent can help drive the repair, right? That's,
Yes, and a lot of people there, what we call fractionated nutrition. We do know the research shows over 10 million blood smears, 10 million tissue samples. I think to date it's like 37,000 autopsies. Of that, they've deemed nearly 100 nutrients as essential. And the key point here is essential means your body cannot make it. You must take it in because it is going to impact one of the many processes of the body. I also tell people go educate yourself. Look at the four basic tissue types of the body. Over 80% of all conditions come from that. You can check that out on YouTube. It's simple, learn those. And then with this microcurrent in particular, because I've seen microcurrent in action for pain. I haven't seen others do what this does. And this, we have we've got four, no, five with the lights now. This is 5 in 1. You've got five devices in this machine. So yes, I love what we're doing. Keep talking, bring it on.
yeah. Okay. So I think you just held it up right there. But what is if you were to have a favorite device? I know people are often like, what do practitioners like? When you recommend your clients get a device, you don't always recommend they get a Pinnacle, do you? But that's the one you use?
No, oh, well, that is the one that I use the most. And, if I'm speaking to a practitioner, I have a total of five because I'll be running more than one room. And what I love about the Pinnacle, and I almost didn't get it, but it has the 12 autoplays. So I can do my hands-on and then I will basically set it and forget it. Remember that old Ronco?
Yep.
Set it and forget it. And I let the programs do, what it does in 6 minutes would take me, I'm going to say at least 15 to 20. It's more powerful. And then if I need to, I step in and I'll switch the mode, like if I'm working on bone and nerves, or I'll just show the client, hey, at the 6 minute mark, do this. And then I can go in. I am doing a hands-on with somebody else. And again, I've got a second pinnacle. Set them up for an autoplay. They're getting more from me than they would have otherwise. And they're not, I actually, that's all included in my price. So as a practitioner, I think of all these amazing ways that they could be helped, but it's not just about the practitioner, the person at home. I have a lot of people that just, they come to my house and everybody knows you walk in, a lot of times that's the first thing they ask for. I taught them what to do, and it's just like it's over there in the corner. And I love the set it and forget it. I'll just tell them use the wand, use the pad, use the comb, you know, um, grab the PEMF device, attach it, the lights, and we can still have our visit, and they're getting a little love while we're together.
Yeah, yeah, absolutely. I think that's a big thing. Like it can, as you say, it shortens the time. And one of the questions someone said was, "Hey, so do you just use the pads when you do the set it and forget it modes? But you often use the Y probe and
Yes, so I mean the Y probe, and in a minute we're going to talk about the lung trial. Of course, we use the Meridian pencil. Um, I Probably two of my favorites. I'm trying to think. This is my most used, the wand,
Mhm.
most used. One of my favorites, it looks like a little mini version of this, is the tongue depressor, because that can impact things that nobody else can do. I've never, we're talking traumatic brain injury, we're talking PTSD, um, stroke. The after recovery stroke program that we do is, I mean, it's always almost miraculous. I mean, I'm trying not to become callous, or sometimes I'm like, yep, that's what we see. And it just feels, well, it feels normal now.
Yeah. I know. Yeah, something my mom said a few years ago in one of these interviews. She said something like, we see miracles every day to the point where they're almost not miracles anymore. So you kind of have to remind yourself that
Yes. Yes.
to people, the things we do see with this technology are truly miraculous to those that aren't in it. And
Yeah.
try, as you say, not to lose sight of the fact that this is not just normal in the world to be able to see this kind of change.
Well, and I thought it was, hooey, because, I worked at several of the largest military hospitals, and I thought, if this, even nutrition, if this were really working, we would be doing that here. I did not have an understanding, as I'm going to guess 90% of those that do work in hospitals truly didn't, that's a consumer mindset. They don't understand that, there is a matrix, and it is about the rate of return, and the monetary that it brings.
Yeah. Yeah, and it's unfortunate. I mean, that is a question I get a lot on webinars I do and on stage talks, and it's always people saying, "Well, if this is so great, how come everyone doesn't use it?" And it is
Yeah.
restrictions, and this is a good segue into the clinical trial because the amount of work that goes into any kind of trial and the amount of trials that they want to see before they give anything even any notice is just tremendous. And it was how many years ago was it when you started? Was it 2, 3 years ago when you started looking into this?
Yes, yeah. So we had done somewhere in 21 a number of classes, and just offered them free. We had community events, and I still do that every week. Uh, but what we were doing was just recognize, I mean, I recognize just from personal people telling me happening in their families, that, people were either extremely sick, on ventilators, many have died, and they went in for one thing. No one addressed the lung issues. And it was like, wait a minute, we can help with that. Why aren't they coming to us? Well, they have no idea. So, I just put together this class. We had such phenomenal success that, I remember reaching out to you. Hey, what do we do here? How can I make this into something that we can share with other clinics, other people? And like you said earlier, we may not actually be able to create a full clinical, it's all on the full clinical trial scale. But because they will eliminate much of what we're doing, we still have the case studies, and that's something that they cannot take away. And to date, there's over 75 in the case studies alone that have had an increase in their O2 saturations. We test in 4 areas, and some of those improve, some of them don't. But ultimately, I started that was one, to keep the impact on the OR, excuse me, on the ERs down for people coming in for something that, this at-home simple device could in fact, much like an inhaler,
Mhm.
increase their lung health and lung capacity. And, over the time, we've seen so much more.
Yeah. Oh, yeah, absolutely. And I think it's huge. And the being on the side of closer to Avazia and what they've done with their clinical trials for wound care to really get any amount. I mean, it's taken 5 years. It's been replicating the study time after time after time, and it's cost a lot of money to get very little interest from the FDA. It's all about like kind of we got to do what we got to do. But as you say, with these case studies, we can show these to people as an alternative to show them that there is an option to solve these issues. Someone has asked here as well, because I think they've asked a few times. So when you're doing the set it and forget it with your clients, are you letting them use a Y probe or are you putting pads on them?
I see. No, I am at that point putting pads.
Right.
But there's if you go to sports medicine, they will use a microcurrent device with pads, and there's about 7 programs, and it does nothing like what this does. Most of them are either muscle stimulators or they are, impacting some pain. But yes, I will use pads for the set it and forget it or the autoplay.
Yeah.
And there are 12 of those on the Pinnacle, and we have at least, is Blue Stem considered an autoplay?
It's kind of, it's an interesting question. I would say, like, to a degree, it does so many things that it
Mhm.
could be for, as to a lesser extent. I mean, it takes around 2 minutes to cycle through 163 frequencies. So it could, and with the randomization of the pulses and its ability to regenerate, to do anti-inflammatory, even in that scar tissue range, I think that there's an argument to be made that it kind of could be considered an autoplay mode.
Yeah. Yeah. If I answer the question,
Yeah,
yes, I did. And, but it's not you don't come in and see me. And having the wand for those that are listening, this has the most active results over the pads. And you want to understand that whether it's your PEMF pad, or your conductive pads, or I absolutely love the garments. Oh, I have been loving those. Ultimately, they will replace the cost of my, replacing those sticky pads.
yeah, yeah, and it's definitely like as you said, like people should be aware that generally you get faster results actively working with the Y probe than you do with the pads. And but
Yeah.
I absolutely would agree with you. Like you're not going to leave your patient holding a wand in a room and leave not knowing what they're doing, right? Whereas you can hook them up, you can let them relax, and you can move on. It does make sense for multitasking in that way. Okay, so let's talk general successes. Like, what are some of the biggest turnarounds you've seen? Like, you say miracles, we see these. Like, let's talk some of those.
Okay. Well, I've got a number on my Facebook, but the first one that comes to mind, I had a lady come to see me. She had been drooling for 41 years after she had a car accident, um, and she had a traumatic brain injury. There were multiple things going on. While we were not actually intending to address the drool, that was secondary. Um, I think it was by her second or third session, the drooling had stopped completely, and that made such a huge impact on her life. Uh, I'll tell you one more about her. When she was hit, she was actually in a coma for 4 months. They didn't expect her to survive. She had to learn how to re-walk, talk, everything. Her frontal lobe was damaged. Uh, she had it was more than just a drop foot. The connection just never made again. So I worked both on a drop foot as well as on the function of the brain. All she wanted to do was to be able to go to a kids' camp and not be the center of attention because every day of her life for 41 years, she would fall 5, 8, 10 times. And now just think about this. She also had more trauma because oftentimes, because of the traumatic brain injury, the hands would not come out to brace her. And so she'd re-injure. And it took us we were probably somewhere between 5 to 6 months. And she was able to go on that trip. She was not the center of attention. She did trip 3 times during this, twice over students' backpacks.
Those things rolled in the way.
Yeah. And so absolutely phenomenal. I remember the first time that when we were probably maybe 2.5 months into it, she was holding a glass of water and she went to go stumble and trip. And she says, Yvonne, I set the water on the table and she was able to bring her hands out.
Hmm. Wow.
Something that hadn't been happening for 41 years.
Wow.
Um, some other successes, and there's been many stroke like that, especially with like the drop foot. We've had great success with that. I told you the one about the gal with the eyes. Um, when we've done just little wings, the sphenoid processing, had somebody with was having intermittent epileptic seizures, and the increase, or excuse me, the frequencies of seizures has changed. It has, they went from having them on a fairly regular basis during the month to more monthly
Mhm.
instead of more weekly. Um,
Wow.
let's see. Oh, Crohn's, colitis, bleeding from those type of conditions. We've been able to stop and then with some continued sessions actually improve not just the gut health, but they saw changes, everything from their bowels to their sleep to their eyesight, to memory, because we're starting to actually move some things out. When you've got gut issues like that, the oftentimes, well, if it's colitis, that's something like there's a wound and it is, has breached the barrier. So now you have stuff leaking into the body, much like plumbing in your house. When you have a leak, it should leave the house, not, come leaking into your living room.
Right.
So those would be some the lung trials. I'll tell you about one lady on oxygen, and I think we probably did 3 sessions with her, and she could not go into the high altitudes. And she ended up purchasing her own device at home, continuing to treat herself. And she now runs up and down here. We're here in California from Sacramento over the Grapevine. She goes into Tahoe. These were things she could not do. She always had oxygen with her. She has oxygen at home. And I think now at this point, it's just as a precautionary,
Mhm.
but she is not using it on as far as I understand, it's not even on a weekly basis.
Wow.
It's just, I think she's got a little, uh, uh, just in case,
Yeah. Like a
a little
safety blanket.
PTSD there.
Awesome.
Uh, so yeah, those are some that come top of mind. I'm sorry I didn't have anything written down for you. But yeah, there's just, I mean, frozen shoulder, I had a gal had adhesions for 3 years,
Yep.
could get her shoulder about right here, couldn't do her hair. Her spouse had to help her put her sweaters, her shirts, everything on. And I mean, in one session, she was probably like at 80%.
Yeah.
And second session, probably 100, but we did a third because she wanted to. And again, since then, she's purchased her own home device. And, much with your customer support help as well as mine, just working together. I told her, you've got me, you've got them. And so uh, it's it's been great. I have another gal that had uh, chronic regional pain syndrome, and she was in bed for 20 years. And she actually got a little more pain before she got a little relief. And so I'm so glad that she stuck around with us because we definitely inflamed or fired something up. But it's important to recognize this microcurrent cannot hurt you. I mean, unless you turn the power too high. And we may undertreat you, but it cannot hurt you. Now, we elicited a change with this gal. Her name is Kathy. And again, she actually went into a higher pain uh, for some time until we could bring that back down. And that's 4 years. She's out of bed, she's volunteering, she's working. I mean, this gal she's almost nonstop. Now, her CRPS is still an issue, but she uses the evolution to manage her pain. And, with the nutritional component, that made its own impact. So I mean, she's got her life back, 20 years in bed.
Yeah. Yeah, to be able to walk around like as you say, like it's
Yeah.
an absolute miracle for people that are not able to do it.
And I want to tell you about Roy. Roy had 70% insufficient vascular. He was slotted for surgery. They were going to amputate one foot, potentially a little higher up to the knee. They had not yet determined and then when they got in, they would determine the second one. Rob, we did probably 6 weeks every single day, 3 times a day, using both the wand and the pads. He calls himself Mr. Happy Feet because he's got both of his feet, he's got his legs, he's walking again. Again, just some incredible. I mean, I know we talk a lot about how things happen pretty swiftly here. But if you're not getting the expected results, don't give up. Call customer service, call me. I don't care, but let's get the resolve that you need. And yeah, for some, I think that there does have to be, this is a management, it's a non-invasive management tool, but for many, it's not a management because uh, those issues resolve. And whenever it isn't, a lot of times for my clients, I'll go back and look at their nutrition. Do we have enough that rebuild is actually happening? Because now you've taken all those burdens off the body with the microcurrent.
Yeah.
So let's throw in enough, it's called therapeutic or clinical doses, of these nutrients so that the tissue can actually rebuild itself.
Yeah. Yeah, and it's all about that, right? Like, give yourself the ability to heal and then enhance it, and you're gonna get those results. And, there's a lot of people just saying, wow, 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 about all of these things because these are things people have not experienced, right? And as you say, they kind of become this normal process. One common question in here from people was, how did you fix the frozen shoulder? Did you just use the general standard frozen shoulder protocol? Yeah.
So I do see frozen shoulder quite often. As a matter of fact, during my classes during the week, I actually will set up some of my devices. So if you come to class, I got a microcurrent sitting there if you RSVP because I don't always, but somebody will get 20, 30 minutes and then I'll say, all right, pass it on. But absolutely, we just use it's mostly the evolutions and it's the wand.
Hmm.
And there's a couple different settings. Sometimes, I'm using a little bit more of the fMRSI, but 350 adhesions, deep scar tissue. My father-in-law wasn't playing anything or doing anything for 3 months. And, he was using his device at the time. It was a pro sport. Today he has the Evolution now. And part of it is there's a little bit of a learning curve. And he wasn't dose zeroing. Now, I've done frozen shoulder and didn't dose zero. And then I've also needed to do dose zero, especially if I don't get a change in the first session. It's that simple. If you don't get a change in that first session, go to dose zero. Dose zero stimulate. Learn it. It's in the book, page 23 to 25. Those would be some of your, if you can grasp that, you can do, again, this is a hospital in our hand.
Yeah. Yeah.
I don't
That's
know. I can't say that, I don't know of another device where we can say that.
Yeah, and I think you hit it on the head there. A lot of people get hung up on dose and zeroing, so we tell them not to worry about it until you need to use it. And if your body is not responding, get
Yes.
your brain to pay attention to the area. Dose and zero, acknowledge the area, and you will start to see those results. It's just like a key and unlocking everything, right?
Yes. And sometimes you have to dose zero every day for 30 days.
Yeah.
Keep doing it until it's resolved. And then, I do have a gentleman who's got a knee issue. And when we started looking at his diet, what he wasn't intaking, I'm telling you what, as soon as we got the nutrients in him, he's like, wait a minute, what just happened? And the microcurrent got you in the best situation. But you know what? If, what you're putting in this pie hole really matters. If it's stuff that's stealing your nutrition, if it's packaged, I'm going to tell you right now, it's stealing the nutrients from the body because the body sees it as as the enemy. Get live food, supplement because our soils are deplete, our food is just not what it once was. We have pseudo food.
It's very unfortunate. And in fact, we talked about that in a podcast episode, which is coming out the first week of April. So if anyone wants to learn more, you can hear from Yvonne then as well. Okay. Well, we're kind of running out of time, Yvonne, but I really appreciate you showing up here and talking to everyone. I can tell everyone's really excited to hear that there is hope. It's one thing when I tell them, but it's nice to have others step in and say something too.
Yes, yeah. And I love what you're doing as well and your whole team. It's been wonderful to just watch all of this grow as, we're impacting other lives. And if for anybody that's wondering about the Pain Free for Life week, get into the Facebook groups and just in the search bar, type in what you're looking to know about, and you're likely to see many many ways because there's other practitioners in there. Um, and Rob, don't you have like a 30-day money back guarantee? I mean,
Yep, you got your 30-day money back guarantee. I think, this is an investment in you're gonna use this forever. Not because you need to, not because you're not gonna resolve those issues, but if you have one of these devices, as Yvonne said, this is the hospital in your hand. Next time you stub your toe, next time you fall, next time your kid trips and gets a scrape, someone gets a virus or a lung infection, you'll pull this out and you'll use it to get the results that you're looking for. You will no longer be beholden to pills and injections and even surgeries. Not saying that there's not a time and a place for those things, but this is something where you can have a first line of preventative medicine that can also address these issues as well.
well, and Rob, I just want to throw this in. I said in the beginning, And when people come to my house now, one of the first things they say is, "Oh, hey, by the way," and I'll just point over in the corner. It will get to be that you'll be able to help others in your family, your friends as well, or at least show them another option to whether it's pain or chronic conditions, going on in the body.
Yeah,
And
absolutely.
yeah, there's so much I got to tell you right now. I'm thinking of all of these amazing things that, as I'm looking at the chat as well, scoliosis. I mean, I had a 57, 54 degree curvature that we were able to help her resolve. I had some that were, UC Davis surgical candidates. They went in for that. They were not a candidate. Someone told them about me here in Sacramento, and we were able to make a change.
Yeah,
I mean, big changes. These aren't just, as you know,
yeah,
the,
there.
these are life impacting. The lady told me she had not, here's how she was judging, because without the x-rays, how she was judging her treatment. She could only stand and do her dishes for about 5 minutes before the pain set in with her scoliosis. The dishes on her counter had not been cleared completely for 12 years after about 10 sessions, because she had that interstitial scarring. So it took us, the body just wrapped itself, it made its own brace. And so that took us a little bit more time than most scoliosis. But she said, Yvonne, for the first time in 12 years, the dishes are completely cleaned off my counter. And yeah, yeah, you're going to be able to help a lot of people.